Hi there and welcome to Meet the Experts. I'm Dori Soukup and with me today is my special guest, Dr. Zoraida Navarro. She is from West Palm Beach and she's here today to share with us her expertise on how she helps her patients look and feel good from the inside out. I am super excited. You're going to hear an amazing interview, so stay tuned and we'll be right back. All right, well, welcome back. I want you to welcome Dr. Zoraida Navarro from West Palm Beach, and she is here with us today again to share with us how we can look absolutely beautiful working on the inside as well as the outside. Dr. Navarro is an internal medicine doctor and she is an anti-aging expert. She has so many great things to share with you today. You are in for a true treat. So welcome, Dr. Navarro.
Nice
It's so great to have you.
Thank you.
Yeah, so I was so intrigued by your story, and that's why I really wanted to invite you here, because being an internal medicine doctor, you're always helping people feel good. And what you were telling me with your entire story and background, how you actually made the shift from just internal medicine to actually going into veins and then actually into anti-aging. So why don't we start by informing our viewers, how did you make that shift? How did you get started and how did you end up where you are right now?
Well, when I first went to medical school, I was considering plastic surgery because I wanted to help people. And in medical school, I later found out that it doesn't matter what you look on the outside if you're really not good on the inside and if your brain's not working well. So I got very intrigued with internal medicine because I like to solve problems. I'm like a little detective. But I had to solve my own problem. Towards the end of my graduation, I started getting some really weird, heavy pains in my legs. Nobody could diagnose them. Because I wouldn't take no for an answer, I found out that I had varicose veins and some problems. I was shocked because I didn't really seem to have much on the surface, and I discovered that people can have varicose vein problems and not show too much. So you might not show anything more than a few spider veins. In my quest to get fixed and to get treated, I went to Europe and I started to see things that we didn't have here in the United States. I noticed that they used a lot more herbal products. I noticed that doctors in France were as concerned about the skin from an internal aspect of nutrition and supplements as they were on the outside. And that was totally foreign because we were not into functional medicine. 30 years ago, if you went to what you would call it, Whole Foods, people would call you a health nut, health nut, And so, but as an internist, it made perfect sense to me. And I was like, my goodness, why don't they teach this in medical school here? Why don't they have a comprehensive approach to patients? So I started learning as much as I could about veins. And of course, I started doing the little spider veins, very cosmetic. And by the time I finished, I was doing vascular type surgeries on my patients. But the problem became that as I started fixing people's legs, they would say to me, listen, can you do something about my face? What about this? Have you heard of Botox? I go, oh, yeah. Last time I was in Europe, I heard about Botox, but it's not here yet. And so I got very intrigued. I realized that people wanted this also. With the veins, I realized that people who came in with leg problems and cosmetic problems on their legs, when I took care of their legs, they would tell me that their personality changed. They were people that were always hiding their legs in pants. They wouldn't go to the beach anymore. They wouldn't go dancing. And it really changed their aspect. And I started thinking, is there anything with the circulation that could actually affect you mentally? And I found out, that there's a lymphatic circulation, there's a venous circulation. If you have stagnation in either of those two, it can actually change your mood. And I just went down the rabbit hole. I went down the rabbit hole. And I realized that if I can make you feel good and feel better just by doing your veins, what can I do for your face? When some people, that's the first thing you get up in the morning. Most people don't even check their legs, but they see that. And the more I got into it, just the more I felt like I was Yoda. People would come to me with problems that nobody seemed to be able to fix, had been looked at in one direction only and hadn't been looked at completely, I would like to say, in a functional manner. So I'll give you an example. I would have patients that would come in with horrible eczema, Well, I would go and take courses in nutrition because I was an internist.
Yes.
And they would mention, you know, some people who have colitis can get eczema. And I'm thinking, gee, is it possible that maybe my patients with eczema have something going on with their colon? And sure enough, I found out about probiotics and prebiotics,
Yeah.
supplements, glutamine, and things that could help you heal. The same thing happened with acne. You know, a lot of my acne patients have failed treatment at other offices. You know, they've been to like your typical dermatologist, you know, but a dermatologist, God bless them, they take care of the ill skin.
Right.
But they're not experts in making you age. They're not experts in making the skin get healed. They're not expert once you get the acne, getting rid of the pock marks.
Yeah.
So it opened up a whole new world to
Like
me.
evolved.
And evolved.
Yeah.
So when people look at me, go, wait a minute, you're an internist.
Yeah.
And you do veins and you do face. I mean, are you a jack of all trades?
Yeah.
And the truth is that I'm really not a jack of all trades. I'm really a master of one. I'm a master of taking skin problems that most people have tossed in the wastebasket, and most doctors have told you that you have to live with it. And I find innovative solutions for it.
Yeah. Well, that's what I like about what you do, actually, being an internal medicine doctor. And a lot of the issues, like you're mentioning, actually start on the inside. And then all of a sudden, they show their causes on the outside. And whether it's aging, whether it's acne, like you just mentioned, and all these other things. But a lot of people think it's only on the outside. And that's what makes you so unique with what you do. And I love the fact that you do that, because it's so true. And a lot of people just don't address it that way.
No.
They really don't.
They find the solution when you have a hammer, everything looks like a nail. So if you go to a dermatologist, they're going to give you some little cream or some lotion and potion, you know, and hope it goes away. And then when it doesn't go away, they give you another lotion and potion.
Or some antibiotics.
And then your gut is really destroyed. And the other thing is that, you know, I went to MIT, so I'm a nerd. I'm not afraid of technology. I was one of the first people to have all these kind of facial lasers in my practice.
Nice.
So again, you know, a typical doctor is not going to tell someone who's got pock marks from acne to do what I do, which is I say, let me fill those little pock marks with filler and let me take laser to resurface the skin. You know, so it's a different approach. And the nice thing about it is that every patient is unique. You know, so when a patient comes to see me, I ask them what they've done before, what's been happening with them. But I ask, because as an internist again, I ask pretty comprehensive, like, what's your health history? What's happening with your family? You know, a lot of people don't realize that, you know, oh, I have psoriasis. My mother had psoriasis.
Yeah.
Well, it's not that your mother had psoriasis. It's that your mother doesn't have the right bacteria growing in her colon, and she fed you the same junk she ate, and now this is why you have a problem.
Yeah.
So it's amazing. It's amazing. And the doctors that I hang out with, I really try to train with the best in the field.
Yes.
You know, if I'm going to spend my time, I want the best, like, you know, being here.
Yeah.
I want to be the best in the field. And you learn so much, and it's just an innovative, and it's a happy field, you know, because for the most part, you know, people come to you, they look better, and they feel better, and they send you more patients. So it's a win-win for everybody.
Let's talk about modalities now.
Okay.
I know you've been doing aesthetics for over 20 years in your practice.
Right.
Let's talk about your menu and the different modalities that you wanted to offer so you can satisfy the needs of all the patients that were coming in.
Okay. Well, as we're talking about threads, we do threads to lift the face, and we can do threads the eyebrow, the cheeks. We can do them on the neck. We do all types of derma fillers, so I can give you cheeks if you don't have cheeks. I can get rid of deep lines. I can give you a nice strong jaw if you didn't have one before. Let's say, for instance, you've got big masseter muscles and you look like a linebacker with this big neck. We can put Botox in there and slim your neck and give you a nice V shape. I have all types of lasers in the practice. So let's say, for instance, you have bad décolletage and your skin is awful from sun exposure. We can do several different vascular laser and topical laser treatments on you to help that. Let's say, for instance, you've got big veiny hands. A lot of people do hand rejuvenation, okay? But most of the people out there doing hand rejuvenation don't rejuvenate the veins in your hands because they don't know the anatomy, and it can be very dangerous. So I can actually inject and get rid of your veins, and I can actually inject derma fillers in it. And now I've trained with some really wonderful people out there that have done some, again, very innovative things. Everybody knows about Sculptra, and everybody knows about PRP, but nobody knows that there's something called Plasma Sculpt, which is a combination of both. And it gives you incredible results, and you can use it to volumize a face, change the skin texture, decrease the pores. So we do that. A lot of people don't know that you can use Radius for the hands, but you can also hyperdilute Radius, and you can inject it everywhere, and again, give you a firmness. So I have a lot of girls that have very wrinkly area between the girls.
Yeah.
And so, you know, if you try to inject it with any kind of derma filler, sometimes it just looks abnormal. When they move, it doesn't. But if I do a little bit of hyperdilute Radius, that whole skin gets refirmed up, and it looks like they've lost 10 years on their legs. And then I'm really well. I'm very well known for my veins, but I'm no longer doing the medical veins. I'm doing mostly the cosmetic. I'm doing very advanced procedures on cosmetic rejuvenation of the legs with veins.
Okay.
So a little bit of everything.
Okay, sounds good. Let's take it a little bit at a time and expand a little bit on each one. So when your clients, your patients were coming to you and asking you about the different things, I'm sure they started out by first asking you, who do I trust? Where do I go? So how did you transition from internal medicine and veins to actually offering aesthetics? What was that transition like?
The transition was a lot of patients really loved what I did with their legs. Okay, a lot of patients trusted my acumen with, you know, things that they had like gastrointestinal problems or reflux and stuff that even their regular internal medicine doctors weren't helping them with. So they kept telling me, you know, you should do this. You should do this. You're good with veins. You can get rid of these horrible veins. You can do this. And I kept saying, oh, you know, I got enough on my plate. But then I started going to conferences worldwide. And guess what? They'd be, in one room, they'd be teaching veins. And in the next room, they were teaching you all this stuff. And I started to learn. And of course, you start slow and you start with your staff and all your girlfriends and all your friends. And the more I learned, the more the easier it became. And then the other thing is, it's very hard to do very good vein care. It really is. Okay, you have to have not just acumen and science, but you have to have a feel. There's an art to it.
Yeah, and you have to have steady hands.
Yes, and if you could do that using I mean, I use 34 gauge needles. I mean, those are the needles that they use to do surgery in your eyeball.
Yeah.
I use those to actually inject some of the spider veins, and I get rid of spider veins like crazy. So it just lent itself naturally. And then, to be quite honest, as I'm getting older and things are dropping, I wanted to find out what was there too, you know, because we want to be part of all that.
Absolutely.
So that's how I did. And the reason I felt comfortable doing this and doing well with it was because I did. I took the effort to being trained with the best people, the safest people. I always tell people, I never want to know how to do a procedure. I want to find out, if I do that procedure wrong, what do I do to fix it?
Yeah.
And if I can't fix it, I won't do the procedure.
Yeah, there you
So that's what it is. So, and then you have to go, you've got to go to people who do a lot of it and do a lot of it well.
Yeah.
And that's what I've done. So I've trained with people like Shino Bay and, you know, Dr. Rajani, and, you know, all these names that are out there.
Yeah.
But they are the best of the best. And because I want to bring to my clients, you know, worldwide information, and also those types of people who train other people. It's like a mastermind alliance, you know. They know what's up and coming. You know, the next thing I want to do, quite frankly, I want to go to South Korea.
Nice.
And I want to learn, because they're really at the forefront of a lot of rejuvenation things that we're not doing here. And I'm sure I'm going to come back with a lot more stuff in my magic bag, you know. So
I love South Korea. I was in Seoul, and you're so right. When I was there, I was amazed at how their women looked, and on every corner was an aesthetic place.
Correct,
It's like Starbucks here.
Right.
Because
But they also have my attitude, you know. So for instance, here you will get a facelift, right? So you'll go in, and you're lucky if they tell you to take anything like an anti-inflammatory before you do it, a natural anti-inflammatory like Arnica montana. And they do your surgery and they throw your butt out of the office.
Yeah.
And then for the next 3 weeks, you're swollen, you look like hell. That's not what they do in Korea. In Korea, you go there a week before. They put you on supplements. They put you on collagen. They put you on arnica. They do your surgery.
Yeah.
The surgery they do is microsurgery. I mean, they use the smallest little needles. You're not going to get a scar. You're not going to. They stick your butt in a hyperbaric tank 3 days in a row.
Wow.
So you have super healing, you know.
Yeah.
They have soups and nutrition. They have nurses round the clock in these offices.
Yeah.
So when you go to Korea to get a facelift, plan to be there for 2 weeks. And it's all inclusive, which is kind of sad, because, you know, that's what's called medical tourism. They do a great job.
Yeah.
You know, and when these women come out, the other thing is they're making women in Korea ageless, because you'll look at a woman and you won't be able to tell if she's 20, 30, 40, or 50. It's amazing.
It is
But that's the attitude I bring. You know, it's not just doing a procedure.
Right.
You know, so when you come to my office, I'm doing veins. Everywhere else you go in, Sometimes the doctors don't even see you. They have a nurse, boop, boop, boop,
Yeah.
giving you injection. Not me. You come in, I ask you, tell me about your history. Have you ever had any clots? What do you eat? What's your nutrition? What's going on? Okay. What kind of job do you do? You stand on your feet all day? You don't stand on your feet all day.
Right.
You know, if you come to me and you've been standing on your feet for weeks, I'm not going to do any surgery or anything on you. I'm going to put you in graduated compression hose that you're going to wear every day, and you're going to hate my guts for it. And we're going to put you on nutritional supplements that help your circulation. And then we're going to come in and inject your veins. And then you're going to come and say to me, you know what? How come this didn't hurt? How come this looks good? How come I didn't have all that bruising and all this discoloration that my girlfriend did? So that's the attitude. So that's why I'm very excited about going to Korea.
Well, and that's such a great philosophy to have that pre-surgery or pre-procedure. You do the procedure and then the post-procedure. And you're absolutely right. I have a girlfriend that just went and saw a plastic surgeon. They didn't even give her any instructions on how to take care of herself after her breast augmentation. It was ridiculous. Like, what are you supposed to massage them? Are you supposed to not to? Are you supposed to wear a bra? You're not supposed to wear a bra. I mean, nothing. It was, and it was not a cheap procedure. She paid like $13,000 for it, and it was like nothing.
No.
So it is sad, and I'm so glad to hear that there are people like you out there that care enough to truly do the kind of work that you do. So I think that's amazing.
And again, I don't know if it was luck or it's just the way my mind works, my brain works. But when I went to MIT, you know, they always said, there's no such thing as an unsolvable problem. You just haven't looked at it from the right angle.
Right.
And so what we like to do is we look at it from the right angle. And you know, the other thing we do, which is a little different, is we listen to the patients. We really do listen to the patients. You know, I've had patients that, you know, I've been taught that I can do something one way, okay? And a patient will complain. They go, you know what, I kind of felt that. And I go, well, you shouldn't have felt it. And they say, well, you don't know I did. So then you'll choose something slightly different just to make them feel better. And then you do it on the rest of your patients. And patients go, oh, this is great. I had this somewhere else. You don't hurt.
Yeah.
You know? So you have to listen to the patients. So it's not just a matter of getting educated from the doctors, but it's also listening to the patients, seeing what they are. And then the other thing is, you know, being savvy, being on social media, seeing what people want. I've always been of the mindset that you can go see anybody, okay? Your money is just as green in my office as anywhere else, okay?
Right.
So if you're coming to see me, I have to listen to what it is that you want, and I have to be honest with you and tell you what it is that I can deliver, you know? And I have to do what's in your best interest also. So, you know, you're never gonna see somebody walking out of my office looking like, where's Nemo lips? You're never gonna see anybody looking like they threw battery acid in their face, because I feel, I'm a professional working woman. I can't afford to take, you know, 10 days and hide for a peel.
Right.
So I have peels in my office that, you know, you have a little bit of flaking, you know, and in 8 days you look just as good as somebody had one of these dramatic peels.
Yeah,
you know,
resurfacing or something.
it takes more time, it takes more effort on our part, and it may not be as cheap as the other peel, but you know, you've been able to go to work and not hide for 7 days.
Exactly.
So this is the attitude that I bring to everything. And I think a lot of people appreciate it. So we're not for everybody. I always tell people, look, I'm not the cheapest in town.
Right.
I'm not the most expensive. I said we are very selective with our clientele. Our clientele is very loyal and loves us to death. But and I will do the best for them, and I will fight to the death to get them what they need. But they have to be aware that we are not for everybody, and it's okay. It's okay. You know, so we're looking for
well, you have that trust factor.
Yes.
And I think that's the most important thing. And that's one question we get all the time at Meet the Experts is like, who do I trust to have those type of treatments? And that's exactly what you're doing. You're basically laying out the ground for the type of treatments that you guys offer and what they can expect from it. So I think that's wonderful.
Thank you.
It's congratulations on that. And especially since you've been doing it for so long, it makes such a big difference.
I know.
So let's talk a little bit about how you combine, you know, whether it's supplements, whether it's skincare with the procedure, how you give people like the whole look.
The whole package. Yeah. What the Jewish people say, the whole Megillah. The first thing I do is it starts with the history. You know, you got to sit the patient down. You have to take them on a little discovery journey of what's going on with them, what have they been doing, you know. You can't always trust patients, you know. They'll come in and they'll look like, you know, Mother Teresa. And then when you get down and they start trusting you, they say, well, you know, I do a little alcohol and I smoke and da-da-da. You know, in the meantime, you wouldn't be able to smell smoke. So you got to ask them, okay. Once you do that, then you have to say, what are the most likely things that people do? It's like people who smoke, they have no vitamin C. I don't care what anybody tells you. I mean, their vitamin C is like non-existent because they're creating so many oxidants that their body's just. So that's why smokers, their skin's all wrinkled. They look like hell. They look like they've been running
through the ringer.
Hard, yeah, ridden hard and put away wet. You know, like they say for horses. So for those people, right away, you know, you have to see what they're. A lot of people have problems with digestion. You know, so I'll ask somebody, and I say, "Oh, you look great. You must work out. You have great shape." You go, "No, not really. You know, I have some digestive problems." I said, "Tell me more about it." You know, I eat, and you know, half an hour later, my stomach hurts and I'm gassy. I already know that you have probably bacterial overgrowth in your small intestine. Like you're not making any vitamin B12 and whatever vitamins you are passing right through. So these are the things that we pick up. That's why we have IV nutrition in the practice. So I look at the patient. I ask a pretty intensive, you know, questions about diet, how they feel, what they eat, what they do. Sleep is so important. You know, if you don't sleep, you know, the bags under your eyes get worse. You know, your skin doesn't do well. You have to move. You know, I used to be very, very active, and I've gotten sedentary, and I have to blame myself. I have to get out of that attitude. But I think the situation worldwide has made people pretty sedentary. But if you exercise and move, you'd be surprised how much better the skin looks and everything does there. So I will look at a patient and say, what is it that you want to accomplish? So if you say to me, you know what, I just hate my cheeks, you know, they're down and I don't feel like I have, you know, I'm going to say to them, are you sleeping? What kind of pillow are you sleeping on? Are you sleeping on this side of your face, which is that's what you're doing. So again, it's a very neurotic, total procedure. So then we'll sit down with the patient and say, look, on your discovery journey, this is what I think you should do. And I never sell. I always recommend because at the end of the day, it's your money, your face, and you have to do it. So I'll say to them, look, I don't think that you have enough vitamin C. I'm not going to tell you to stop smoking because I'm sure I'm not the first one who told you to do it. But I do want to let you know what this is causing. And, you know, this is what you look like now. And 10 years from now, this is what you may end up looking like. So you might consider maybe smoking a little less, you know. You might consider having a lot more vitamin C. You're killing your collagen because you have no vitamin C, you're not making it. So take some supplements of collagen. We have some excellent, very nice medical grade supplements that we recommend. Once we do that, then we tell the patient, and look, I can do something. I can give you the cheeks of your dream, but you're not going to be able to keep them if you're not taking in the right nutrition and doing other things. And then I say to them, look, I can give you cheeks, but what about these lines? What about this? What about that? And a lot of times people fixate on one thing, but you just have to give them a mirror and say, look, if you were my sister, and I love my sister, this is what I would do for you. And sometimes I just take like a little Q-tip, stick it in the mouth, and say, like, if I fill this up, you see how that cheek looks better? And look what happens to these lines. And they're, oh, and I said, and look, you see what happens when I do this? If I put a little thread in there, we can do it. And so we make a package. And we let them know. And then I don't like to do everything at one time. I always tell people that I think your body can respond to anything you throw at it, but you have to be gentle. So I can do a lot on you, and I can give you a different face literally in a year, but we go slow. And the other thing is you don't want a lot done so that everybody notices.
Exactly.
I'm a very private person.
Yeah, you want to do it subtle.
Yeah,
right?
and most of the people, I mean, I live in Palm Beach County too. Most of the people there, you know, they sometimes...
You might want to say that again. That's Palm Beach.
Yeah. Some of them want everybody to know they've had stuff done, but most people there are very subtle.
Yeah.
You know, they don't want people knowing their business. They're very discreet. So I tell people, look, don't come in and make me fill your face with 12 syringes.
Yeah.
You're going to look like a bullfrog.
Yeah.
You know, let me do this slowly, and nobody knows.
Yeah.
And then a lot of women don't want their husbands knowing they're getting anything done.
That's true.
And a lot of people don't want their work to know they're getting anything done, because if you're getting something done, you must be getting old, and maybe we need to replace you with a younger person. So this is our philosophy, and it works really well. We do a lot of if people need financing or things like that. I mean, we work within people's budgets and the whole bit, but they have to understand that these things do cost, and you have to do. And you're not paying for the product; you're paying for my expertise, and you're paying for the fact that if something happens to you, I can take care of any problems. So you're paying for the safety net that we give you.
Makes a big difference. Let's talk a little bit about IV therapy, because there's a lot of people, they're popping up everywhere now. And again, since you are an internal medicine doctor, if I'm going to get IV, I would want to go to someone like you. I'm not going to just go down the street to the place that promotes it as a hangover or solution or whatever.
Well, you have to be careful with IVs. Okay? So, number one, you're putting in a huge amount of fluid in a person over a small amount of time, an hour or two. Even if you take 4 hours, that's still a lot. Because remember, you can drink 4 or 5 glasses of water And you're lucky if you change your volume by maybe 10 or 20 cc's, you know, because a lot of that goes into your intestine and a lot of it goes into your kidney and your bladder and it's out. And when I'm putting that in your system, it's in your bloodstream. Okay?
Yeah.
So if you have any problems with a little bit of hypertension, you have a history your kidneys not working so well, you can actually put a patient in fluid cardiac arrest, you know, congestive heart failure. So you don't want to do that.
Yeah.
There are people who have something called G6PD dehydrogenase deficiency, okay? A big fancy word. But if you take those people and you give them something called glutathione, the red blood cells break open and they can have a catastrophic event.
Wow.
So when people come to us, you know, we do, you know, yes, most people can get it done, but we do an extensive history on you. We check for G6PD on everybody because you don't know who has it, you know, and you don't want to find out when they're in your chair seizing that they have it. And we also work with a company that's very, very, I would say, beyond reproach. I mean, they are so ethical and they make the products well and you will never have to worry about them doing anything wrong. So I feel confident when I have a patient here, you know. Years ago, there were some compounding companies that mixed some stuff that neurosurgeons use, and they ended up giving people infections.
Oh my gosh.
So we work with an extreme and a proprietary, very, very good company, and they do good work. And then we have our IVs given to you by nurses, you know, so we don't have, either have EMTs or we have nurses give you the IVs. So God forbid you should have any kind of reaction. That's the person there that can take care of that. Why do you want IVs? Look, you could pound, you know, 6 bottles of orange juice and you won't get the buzz and you won't feel as good and you won't get the hydration and you won't get the saturation with vitamin C that I would do is if I give it to you in an IV. Okay. A lot of people don't digest well at all. So a lot of the stuff that you're trying to get in, I mean, they're pounding back vitamin C and B12 and the whole bit. But you're not digesting,
not being absorbed.
and this is going directly into your bloodstream. A lot of people have cancer treatments, and they really are very depleted because these things bother you. Some people do. Do we have people who party too hard on the weekend and say, "Hey, doc, I got to go to work and feel better"? Yeah, but that's not really our purpose. You know, if you do it once in a while, it's not a bad thing. You know, some places do it because some people think, well, I don't think it works, that if you go get an IV and you've been doing drugs and you know you're going to get drug tested tomorrow, that this is going to flush you out. So I haven't seen that it works, but we have had some people come in and if we figure that they're doing it, we just say, look, we really don't want to take your money for that because you're not going to be happy because that's not the purpose of this. But the purpose of, like, if you have like a really dull skin, you know, you just don't have any glow, you know, that pretty girl pinkness has gone, you know, we give you an IV of glutathione, you know, every week for a month, and your skin just becomes radiant because you're just giving it what it needs, you know.
You're nourishing.
You're nourishing, yeah. And we have stuff for, you know, people are under stress. I mean, I don't have to tell you now during this time of year. People a lot under stress. And so guess what? When you're under stress, your gut doesn't work well. You don't absorb well. So again, people aren't sleeping. So we have IVs that actually help you replace all the minerals that we know will relax you and help you have a good night's sleep. So if in a perfect world, honestly, people should go get, you know, some IV nutrition once or twice a month, seriously. You know, but it depends.
Especially now with all the pollution, the environment, and the food that they eat, because every food is horrible, especially if they eat out a lot. So how would someone choose? I know you're in the Florida area, West Palm Beach, but how, like, if I lived someplace else, how do I decide where to go get my IV? Because like I said, they're popping up everywhere. So who do you trust with that?
Well, I think, you know, there are franchises, but, you know, what you need to know, this is a franchise, is the doctor on premise. If something happens, you want the doctor there. I would look for someone who has a functional medicine background, somebody who really knows nutrition, not someone who's doing this because they think it's a good way to make money.
Or it's a trend, right?
I would look for a place that has nurses and EMTs and paramedics that are giving the IVs. You know, I would be a little hesitant if it's just a medical assistant because if something happens, God forbid you have there. I would also see, where are you getting your supplies from? You know, I would rather go see a giant franchise company that makes these kind of products. You aligning yourself with them or buying them directly from them because they know where all the traps are. They know all the things that could go wrong, and they're not going to risk doing something. Whereas if you start making some of these things yourself, you might make a mistake. I would also ask them, who mixes your supplies? Who puts the things together? You know, because a nurse could be very distracted and put the wrong thing in, and, you know, you're going to play the consequence, okay? I'd also find out, you know, call them up. What do I have to do? Oh, just come in, give us $125 and we'll give you an IV. I don't know that I'll go there. If they say to you, no, you need to come in, the doctor's got to sit you down. We want to check to make sure you don't have the thing called G6PD. We want to make sure that you don't have any congestive heart failure. But I would feel more comfortable with that. And then again, look, wherever you're going, there's got to be a doctor associated with it. Call your local board. They'll tell you what's going on with that particular individual. If they've got lawsuits out the wazoo, or if they had some problems. And again, what is their training? If there's somebody who's, I don't know, a urologist maybe, and they're doing IVs, I'm not so sure. They're a functional medicine doctor, a family medicine doctor, someone who takes care of ill patients and they're doing IVs, I feel more comfortable. If they're a cancer doctor, if you're going to get IVs, cancer doctors are really very, very knowledgeable about what you need, especially after chemotherapy and stuff. So again, check with your local board, get a feeling, go to their website, see what they're about, find out what your initial visit is going to be, find out if they require a consultation. If they're like, oh, just come in and we'll hook you up to a bag, I think I'd run away.
That's very good advice. Thank you for sharing that. Let's talk a little bit about skincare. And because we were mentioning earlier how things come from the outside, from the inside to the outside. So what is your philosophy on skincare?
Well, skincare, for a long time, I used to believe in all natural. I got to tell you, it doesn't work. It doesn't work. So what you need to do is you have to get the best of both worlds. So find out what the active ingredients are that really do a good job. Find out that those active ingredients don't cause more harm than good. And make sure that you're packaging those ingredients in a base of some sort that is free from as many toxins as possible. Retin A, retinol, things like that, they're a vitamin source of A. You need that for your skin. You need to keep exfoliating. You need to keep it getting and glowing and being beautiful. We have several different lines because everybody's skin is different. So we have this wonderful line that we import from the Dead Sea, and it's mud-based. It's free of parabens. It's full of minerals. It's a great. It's not a fancy-looking product, So sometimes Miss Palm Beach goes, "This I'm going to put on my face." I go, "Yes," because you have rosacea from hell, and nothing else is going to help you, And yes, that $350 creme de la mer that you're using hasn't worked in 10 years. I don't think it's going to work this week either. So we do that. We also have something. We have a product line that has definins in it. Definins are newly discovered proteins that actually reverse the aging process. So again, not inexpensive, but really good and high quality. We have other products that are designed to supplement your hormonal status. So we have a product line that's good for women who have menopause and had changes in their skin. We have one that is really great for our little millennials, the ones that got too much junk. They wear so much makeup. They put so much crap on their skin. They eat garbage. So their skin is dying, literally. So we have a product line that actually addresses all that and helps detoxify the skin and gives them their glow so they look selfie ready, but and isn't too complicated because they like things, they don't like to use the brain, the millennials. They want to be able to go to their cell phone and get it right away, So you have to think. What we do in the practice when we're doing skincare, we think, who's the end line consumer? What do they need to do? For instance, I never in all my history prescribe more than 3 skincare products to a man, ever, because I'm lucky they used to. And we're talking about even the most vain guy. So you have to know what your prey is so you know what traps to set out. So for my older ladies, they like things that are very emollient. They love things that smell. I don't particularly like a lot of that stuff because people can be allergic to it, but that's what they like. So we have to have product lines for them. The millennials like things that work great. They look fancy, but not too fancy, and they have to work like tomorrow because they got no patience. So we have that for that. We have teenage boys. They're horrible. I can't get them to take a bath, much less wash their face. So for them, we have products that smell good and have little texture, but we'll get them to where they want to go. So and the importance of skincare, as one of your previous guests I saw, you talked to him extensively. Sunscreen is very, very important. And you have to have a sunscreen that has all the things that you need to protect you. It's not just about UVA and UVB. And you have to have sunscreens that don't mess up your skin more than you have. I mean, there are some women now that are getting scarring alopecia, and it's associated with their sunscreens that they're using. So you have to be really careful with things like that. But you need to use your sunscreen. you need to exfoliate yourself. You know, there are things that you can do at home. You know, these automatic brushes and stuff, they really do work, but you have to use it. Dry skin
Like
brushing.
Clarisonic, you mean?
Yes, you know, and doing like dry brushing with a regular, you know, everybody realizes that the horse looks pretty because we brush them.
That's
Well,
right.
if you dry brush yourself, you'll look pretty too. So these are the kind of things
You'll have shiny, beautiful skin.
Well, yeah, because you're exfoliating all the time without irritating.
Yeah, it does. I think that's probably one of the biggest things we hear is that a lot of people don't exfoliate enough, especially if they live in busy cities with all the pollution in the environment. You know, you're clogging all your pores, and it's so essential to exfoliate.
We have in that line that we brought from the Dead Sea, they have something called the Saprophytic Mud. And this stuff is amazing. And so we always tell people,
you put it on the face.
You put it on your face and
body.
your breast and your hands.
Okay.
And you sit there for literally 20, 30 minutes. And when you wash this off, like blackheads literally melt out of your face. But it's important because
I want some of that.
Oh,
what is it called?
Sure. It's a saprophytic mud. Saprophytic mud. It's a detoxification. So they come in and they're thinking they're getting a beauty treatment, but they're actually getting a medical treatment. They don't know it. So we'll say, you know, what do you need? I said, you know, the esthetician will come in and I say, put some of the saprophytic mud on them, and they're sitting there thinking, oh, doesn't it feel great? And they don't realize we're taking toxins out of their skin.
Wow.
Yeah, so
that's very good.
Yeah.
So I think one takeaway here for me is it's important to find out what would be the most ideal skincare for you,
right? And
come up with that nice regimen that you would do morning and evening.
But what people don't understand, you know, people think that it's like you're born and you reach maturity and then you wear a size 7 shoe the rest of your life. No, you don't. You wear a size 7 and then one day you can fit into a 6, and as you get older, your feet get wider, and now it's an 8, you know, but you know. So skincare changes on a seasonal basis.
Yes.
So especially if you're someplace that has 4 seasons, you know, you might have a wonderful skincare line and everything's going great, and all of a sudden you have breakouts. Something you're using in your skincare line, either you've changed something nutritionally, exercise, stress-wise, or sleep-wise, or it's time to change. So you have to have a skincare line. I mean, you can love certain products, and you may be able to use 1 or 2 products the rest of your life, but a really good skincare person will make you evolve with what you have and make you look better. You know, and I tell people too, but I like the skincare product. I said, but this one will make you look even better. And then they'll go, oh, okay. And they do it. They go, oh, wow. You know, I go, yeah, because at this point in time, your skin's at a different stage and we need to treat it differently.
Yeah, and I heard other experts that I've interviewed tell me that you're absolutely right about the seasonality. But also, as you age, you require more and more and more. So what worked for you maybe when you were 20 and 30, you only needed a couple of products. Right. Well, now you need 10 products when you're 40 or 50.
Right, yeah.
And that's, I think, one thing consumers don't realize. And they get stuck. People are habitual, of course, and they get stuck using the same thing. When really, in all reality, you should mix up different products because once your skin gets used to certain things, then you get
what's called
it's not helping.
In medicine, they call it tachyphylaxis. If you give somebody a medicine and you keep giving them, some people develop a resistance to medicine. So the same thing happens with skincare products. You get like a tachyphylaxis to the skin product. And again, you know, we start you out. We start you on a nice retinol or retin-A product. You know, we do some exfoliation. You know, we give you a scrub and you scrub out your skin. Now your skin's not that hard, leathery thing you had. Now it's a little softer. If we keep doing that, now you're going to get irritated, you're going to get redness. So now we got to back off for the retin-A and maybe give you some sort of a different serum that'll still keep you moisturized, you know, vitamin C serum or something like that, and take it off. So again, people need to come in and realize that your skincare regimen is not set in stone.
Yeah, you need to be flexible with it. What's the best secret for getting rid of brown spots on your skin?
Well, there's not one secret because brown spots can come from a lot of things.
Okay.
Sun exposure.
How do you address them?
Well, I look at a patient and I look to see what they have. I see where their sunspots or their dark spots are. You know, if all of a sudden they're just getting like little dark spots around this area here, okay, almost like a mask, I'm pretty sure it's something called melasma or cloasma. It's probably hormonally related. Usually I see a lot of that in my 40, 45-year-olds. Those women, we have to put them on a retin-A product, put them on a bleaching product, put them on sunscreen. but I always check their hormones and make sure their hormones are okay. So when you have low levels of estrogen, it can happen, and if you have low levels of progesterone, it can happen. So we would do that. If the spots are because you've been a beach bunny all your life and you know life is catching up with you, then we can exfoliate with chemicals, we can do peels, we can do laser, we can do radio frequency. So there's lots of different ways that we can skin a cat, but it depends on what you have. It also depends on your skin color. So remember, if you have a dark complected person and you get very aggressive, they can get post-inflammatory hyperpigmentation. Big fancy words. What it means is if you irritate the skin in a dark skinned person, the skin can actually become darker than when you started out with. So you have to be very, very careful with that. So when we treat patients, like I have lasers that penetrate very, very superficially. I mean, we're talking about 3 or 4 cells deep. I mean, almost that you do the treatment. The patient goes, I just paid you. Did you do anything? You know, and then a week or 2 later, they go, oh, look, the spots are going away. Yeah.
What other solutions do you offer or are available for people to get rid of wrinkles?
Well, you know, the most common one that everybody's familiar with is Botox. Botox is a neurotoxin. A neurotoxin, I tell people, is you drive by a house and you see a family sitting having dinner, but if dad sees you looking in and he pulls the shade down, you can't see anymore. That's what Botox is. Botox is a shade. Botox doesn't allow your muscles to communicate, your nerves to communicate with your muscles and make them move. The reason people get wrinkles is because they have hyperactivity of a certain muscle, and as the skin gets thinner, because we're aging, all of a sudden you develop wrinkles. So one of the things you can do is you can do a neurotoxin, the shade, to stop you from wrinkling. Now, if your wrinkles are deep, if the wrinkles are very light, doing that will get rid of the wrinkles. But if the wrinkles are deep, now we got to fill them up. So now we have derma fillers. And there are multiple different derma fillers. There are hyaluronic acid derma fillers. So this is like a liquid. The hyaluronic derma fillers come in different concentrations. Okay, and it's really not concentration. I would say it's more cooking stage. So if you take an egg white and you do nothing to it, it's very liquidy. Okay, that's what Restylane would be. You know, it's a very liquidy texture. You inject that. That's great for little tiny lines. It percolates. But it's not going to be good for something deep like this. You know, so for something deeper like this, you need to use a product that is firmer. So every derma filler has a different consistency, and the way it gets the consistency, it's like an egg white. You don't cook it, it's watery. You cook it a little bit like a coddled egg, it's kind of mushy and creamy. You hard boil it, it's hard as a rock.
Wow.
So that's what all the derma fillers.
What a great analogy.
Yeah. So that's what derma fillers are like. And think about it, okay? Do you want a egg white here? You know, if you put it in there, it's going to look like you did nothing. You want something more firm.
Right.
But do you want a firm thing like that underneath your eyes so you look like I got a sausage? No.
Yeah.
So when you go see an injector, not only do they have to know the liquidity of the product, they also have to know how much they absorb water. Okay? There are some products that you put them in and you have to be careful because you'll swell. So they're perfect for some areas, but not that perfect for others. So you need to know that. The other thing is you need to know the hardness, the consistency, the rubberiness of that, the lumpiness of that. Again, in places that you have deep depressions, you want something that doesn't swell that much but is kind of firm. And in other places, you want just the opposite. So that's it. You could also use collagen stimulators. So there's something called Sculptra. Sculptra is a sugar. You inject it underneath the skin, and it causes your collagen and elastin to fluff up. It's a wonderful product because it's very softening. It, in my opinion, changes the actual radiance of the skin. So when I have girls that come in and they have this dull complexion, the first thing I go to is say, let me put a little Sculptra all over. It's going to give you a nice little glow, like a sheen, and that will help. You can take your own platelets. You can take PRP, and you can inject it in wrinkles, and that will help the wrinkles. You can take plasma, PRP, and you can mix it with Sculptra, and you have something called Plasma Sculpt. And that's amazing because you can put that on, and it really, honestly, it takes about 10 years off people's face.
Wow.
And it's a very subtle result, and it lasts 1 to 2 years. So it's really pretty great. What other things can you do to get rid of wrinkles? You can do threads. So you've got something that's here. I tell people it's like you got a wrinkled curtain and you straighten it on the curtain rod. That's what you do. You take and you put a little thread in here. You hook it here, you hold it, and then you pull the thread here. All of a sudden it lifts you up. You cut the thread and it stays there.
And that's what everybody wants. Everybody's always telling you,
I need
even
this, I need
myself,
this, yeah.
please lift me up.
Yeah. Well, it's much different. It's in my opinion, a much more natural look. Because if you get a facelift and they cut you, You look like Sally Kellerman. You know, you look like you eat a banana sideways.
They look like they just pulled you.
Yeah. But when you do this, we can do vectors. So I can do a thread here, just like your own muscles would do. And lift again. Sometimes I don't even have to inject a wrinkle. I can do something funny. I can go and say, you know, the reason you got this wrinkle here is because your fat pads are gone. And if I put something here and lift this up here, that wrinkle goes away.
Yeah.
So you have to really be an artist about how you're injecting. Years ago, you'll see, like poor Melanie Griffith, you know, she was one of the first people.
Wasn't she the most beautiful girl?
But she got all fluffed up in the wrong way.
I was so disappointed.
And she looks like
like a balloon.
Like a balloon, like a blowfish. So, but then you look at somebody like Demi Moore or some of the other movie stars, Halle Berry. I mean, she doesn't look like she's aged. I mean, she's almost 50 now, and she doesn't look like she's aged. These people
or Jane Fonda.
Yeah, well,
have you seen her?
Yeah,
she's 80-some years old.
Yeah, but she's had lots of plastic surgery. But again, everything she does is pretty subtle.
She looks amazing.
She looks amazing. So you need to be able to. So there's an artistry to it. Okay? Look at somebody like poor Burt Reynolds. I mean, I don't know who his plastic surgeon was, but he ended up looking like a Chinese woman.
Yeah.
I mean, so you have to be really careful. So
and you know the other one that was really Kenny Rogers. I think he passed away, but he just totally changed his look.
One of the things you have to do, you know, when you train with some of the stars in this industry, they will teach you little tricks that you don't even think about. You know, people say, "Well, I'm getting Botox. I'm a guy. I'm getting Botox. So you're going to inject me the same way?" No, you have straight eyebrows. If I inject you the way a woman, you're going to look like you have these, you know, arched eyebrows. So when you're doing people's faces, you have to take into account what's their skin color, what's their skin texture, what's their ethnicity. You know, are they male? Are they female? Because you can change everything about them. So I guarantee you that Burt Reynolds went to a plastic surgeon that only did women. He did very few men because he gave him a woman's facelift. And he looked garish. He looked terrible. So my patients, they always say, "Doc, I want to look like me, just better." You know, so that's going to be the name of my next book.
Yeah.
So me, just better.
Yeah, I like it. Me, just better. Yeah, it does. It makes such a difference because when you totally change your appearance, like you said, people notice it and like, what the heck did you do?
Yeah.
And I would much prefer doing the subtle that you're talking about, the subtlety
you have
that
to
you're
grow
talking
into
about.
your looks. I mean, when you start to improve your looks, you really have to grow into your looks.
Yeah.
So if you do something, I find that if I go slow with somebody and I put them on a skincare regimen and we do it consistently, 2 or 3 years later, that person's still doing all that. They're coming back for their fills. They're doing something. Sometimes people want me to do dramatic things, you know, and I say, you're not going to like it. You're not going to look like you. People are going to notice. They're going to know your business. And so the first thing that happens is, you know, they go out there and they're a little puffy and a little swollen. Right away, people say, "What did you do? That doesn't look good." And they start feeling insecure. So I always tell people, you have to grow into your new looks. You have to grow into your better looks. And if you do that, you're going to be consistent because it's like a little habit. And you don't even realize that it's a habit. So you'll use your sunscreen and you'll use your cream and you'll make sure you put the serum and you'll make sure you put your cream in the refrigerator so it doesn't degrade. And 3 years later, you look up and you go, "Oh my God, when did I learn how to do all this stuff?" Because you've done it slow. But if you do too much at one time, that's why I don't do. I told you with men, I don't give more than 3 products at a time. If I do that, I'm lucky they used to. So you want to go slow.
True. Yeah. Let's talk a little bit about skin tags. I think that's a problem that some people have. First of all, is how do they happen? Like what causes them, and then how can we get rid of them?
People think that they're due to old age, but we found out that there are two sets of people that have skin tags. Okay, well actually there's 3. I won't want to scare you. If all of a sudden you have a bumper crop of skin tags, they can be associated with colon cancer. So any person who has skin tags needs to be evaluated. When was your last colonoscopy? What's been going on with you? Any history of colon cancer?
Any particular part of the body, or just
no? Usually around the neck.
Around the neck.
Blow out.
Okay.
Then the next group of people that have a lot of that are people who have insulin resistance. So people who have insulin resistance are people that don't do well with their sugar modulation. And what happens is they start making too much insulin. And what your body then does is it stops responding to the insulin. And this is significant because people who have lots of skin tags, if this is a sign of insulin insensitivity, that's also a big sign of possible diabetes coming in your future. So you want to get rid of the skin tags, but you also want to tell the patient, look, go back to your doctor. Let's check your hemoglobin A1C. Let's make sure your blood sugars are running right, because it can be associated with. It can also be associated with a genetic condition called polycystic ovarian syndrome. Now, you have a lot of young girls that have very irregular periods. They have a lot of acne. They have a lot of body hair. And all of a sudden, they get all these skin tags. And we're talking about 20, 25-year-olds. In their case, what's happening with them is they're very low in progesterone, very, very high in testosterone and estrogen, which is why they're having these issues. And again, you need to find that so you can have the patient put on hormones, put on metformin, so that they don't have this, so that when you get rid of the skin tags, they don't keep coming back. Okay. And then there's some people who can have a viral infection just genetically. And so again, we think it's paramyxin virus. There are other people who think it's a different type of virus. I find that if I put the patient on lysine, which is an amino acid, which apparently viruses don't like in your body, a lot of my patients don't have their skin tags grow back. Okay. So yeah, so skin tags.
How do you remove them?
You can remove them with laser. You can soak them with solution and use radio frequency. So you literally boil the little skin tag on the stalk, and you let it desiccate and it dries. You can, we used to use like an electric pencil and fry them off, but it always left a little scar. With its radio frequency, it doesn't look like you left anything behind. And with laser, it looks like you've left nothing behind.
Very nice. That was very informative. Thank you. Yeah. And one more thing, what about the bags? Like, what do you do with the bags under the eyes?
Bags under the eyes come from different things. So people can have allergies. So the first thing you'd have to see is why do you have bags under your eyes? You have them all the time. We do allergy testing in the office. We do particularly food allergy testing. A lot of people are allergic to food they don't even realize. They've been eating stuff all their lives, so they imagine that they can't possibly do it. We do food testing. They go, look, lay off the bread, because this is showing that you're allergic to wheat, or lay off corn. And they look at you like, you got to be crazy. And then they come back and go, oh, I have no bags under my eyes. Wow. So I guess we weren't crazy. Okay?
Yeah.
So you can do that. The other thing that happens is you have a fat bag. You have fat pad under here, and it disappears. So you then look like you have a bag, but it really isn't a bag. What happens is that this that was lifting you and making it look nice and smooth is no longer there. So that you can use a nice derma filler and fill it, and so you don't have a drop off between the bag and what you have there. A lot of times sleep is important, so we, if we need to put you on some sleeping pills and stuff, we'll do that. A lot of times you need to have some skin tightening, so you'll get some flaccid skin up here. Sometimes it's a matter of getting facials. We have patients that we notice that they don't drain from here, and they have a lot of inflammation. So the bag can be a physical bag, it can be a water bag, it could be flaccid skin. So depending on what it is, that's how we treat it. So we do have some really wonderful skin tightening devices that we have in the office, and they give people some very, very dramatic results. And then we put a little derma filler, and they're very happy.
It's so nice to know that there are so many different options today to address just about every single thing you have an issue with. What an age we live in. It's amazing how the med spa industry and the aesthetic industry as a whole has just gone through so much to truly transform. Really, you can truly transform someone's appearance now with your hands.
When I was a little girl, I remember going into my mom's dresser drawer and finding a picture of my grandmother. And pouchy little lady. She had these black rolled up stockings to her knees. She had this little hat. She had a million wrinkles, and she had this gray hair. And I said, oh, what a cute picture of Grandma. I said, how old was she there, 70, 80? My mother goes, she was 45 in that picture.
Wow.
And I remember thinking, I'm never going to look like that at 45.
Wow.
So it's amazing. But you think back, unless you were a movie star, and we're talking about, this picture must have been, my grandmother's been dead a while, so probably in the 60s. Okay? Unless you were a movie star, there was not a lot of plastic surgery options for you. Women didn't typically dye their hair. They just, wore their gray. They didn't have their hormones manipulated.
They didn't have anything.
Right. So she looked old because she was missing hormones. She was missing a little hair dye, and she didn't have a little tuck.
And they didn't live as long either.
No,
look how much we're living now. Because of all the things. And I think we can even live longer if people did not eat some of the food that actually restaurants are serving in grocery stores.
Well, you're very good with your diet. I'll tell you, I saw you the other day, eating. I said, what discipline? I have to go back to that. That's really good. But it makes a difference
Thank
because
you.
if you eat a
Yeah.
meal a day and if you stay away from inflammatory things, you're going to look better and feel better.
Yeah.
Absolutely.
I try.
No, you do.
I
You do a
still
great
like
job.
my wine though.
That's okay. Wine's okay as long as it's red. White is only calories, but red helps you out. Yeah.
Yeah, I like my red wine, that's for sure. Well, this has been so informative. You are just a wealth of information.
I should write a book.
I'm so excited actually to read your book because I'm sure it's going to be filled with great information. Again, I love the fact that you are an internal medicine doctor plus an aesthetic expert. I mean, what having the best of both worlds is, I think, amazing. And not to mention the veins and being able to truly, because as you get older, I mean, even I'm noticing some things that you start popping out everywhere and changing everywhere. So it's so nice to know that there are experts like you that people can go to. And really, I wanted you to be here so people can get an idea of all the different things that are available right now, right there at their fingertips.
No,
There's no reason to feel bad. There's no reason to look bad. There's really no reason to look down at yourself any longer because of all the solutions that are available out there.
Yeah, as they taught me at MIT, there's no lack of solution. There's no problem that can't be solved. It's just looking at it a different way.
Yeah.
And in our facility, we are not myopic, so we try to find what's best for each patient. We work within their framework. You know, some people love nutrition, so they come in and get all kinds of IVs. They're happy, and they get supplements, and they take them, and they're good. And then some people say, no, use a laser, one and done. I'll come back in 6 months. So we work within your framework.
Yeah, very nice. Well, thank you so much for all your knowledge and expertise and wisdom. And thank you guys for joining us and being part of the Meet the Expert show. And those of you who love this show, make sure you like it. Make sure you ring the bell, the notification bell, so you can get all the notifications when we publish more videos. And stay well and stay healthy. That's the most important thing. And stay beautiful. That's for sure. And thank you again, Dr. Navarro, for being with us today. It's a pleasure. Thank you. And for people to learn more about your practice, where would they go?
They would go to www.drnavarro.com. So it's drnavarro.com.
Nice. That's nice and short and sweet and simple. They know they can find you.
Well, the only problem is a lot of times people put a little dot between the R and the N, but there is no dot. So,
okay, great.
And of course, you know, they can look us up on our Instagram page with the same thing, and Facebook.
Very nice. Well, again, thank you so much.
Thank you. Appreciate it.
Stay well.